Hi everybody, this is Joe Seyoum, CEO and founder of PhantomALERT. For those of you who've been following us and who've watched our demo videos, we've made some changes to the website. And to those who are watching this for the first time, let me explain to you what we've done. So PhantomALERT is a business or an application, a crowdsourced, user-generated service for drivers. What we used to do was our competition, best way to explain it is we're similar to Waze. As you know how Waze works, you see a speed trap or something on the road, you report it, and then you share it with other people. And that's what PhantomALERT does. We have over 2 million users who use our app all over the world to share with each other what's happening on the road, like speed traps, red light cameras, flooded roads, tornadoes, railroad crossings, speed bumps. So you can map out anything you want with PhantomALERT. So what we've done is we've retooled our website. We've stripped out all the other commercial stuff and made it coronavirus centric. And there was a paid subscription here. We got rid of it. We're making this thing free and available to everybody. Right now, we're not concerned about making money from our services. We just want to help fight this coronavirus epidemic. And we believe this tool that we have, our application and our back-end platform and our map, is what's needed by everybody in the world, especially government agencies. So let me show you how PhantomALERT works. And as you can see here, for those of you who've been following us, we've stripped out everything. We made it just specific to coronavirus alerts and reporting, tracking, and mapping, links to the iOS and Android app, and also instructions on how to use the service. So right now I'm going to make a quick demo for you to show you how PhantomALERT works. So this is the alert map, and when every time somebody reports a location, you can see here, 1 hour ago somebody reported a speed trap, 1 hour ago somebody reported a virus alert in Romania. These are probably our developers testing it out, but you can see like every hour or so when an alert comes, you see it here, and then you can click here to go see the location. But so let me show you how we can help the world and especially government agencies fight coronavirus. So the first thing you need to do is go to the alert map. And by the way, all these alerts that you see are coronavirus hotspots reported by the CDC and WHO and John Hopkins. So imagine if all the doctors in Ethiopia and government agencies or government employees, Kabalele members, the Prime Minister's office, anybody who's on the ground would sign up to use PhantomALERT. So the first thing they would do is they would just go in here and register, join now. Okay, you go here, you just join now. I've already logged in. I have an account. After you join, you get an account, and then you can go in here and you can say like Addis Ababa Hospital. So we'll find a hospital right here. So now this is just for demo purpose. By the way, whatever I'm reporting right now on this map does not go live to the public. This is just for us and for the person who's reporting. You can see what you're doing, but you're not sharing it with anybody until it's approved. So let's say there's a doctor who has an office here, and patients are coming to him, and they're symptomatic. They have issues, and the doctor asks him, "Where do you live?" And the person says, "Well, I live right around here." So the doctor would say, would take the PhantomALERT application, and he would put a marker right here, and then he would fill out a few questions. Was the patient symptomatic? Yes. Did he have a fever? Yes. What was the temperature? He had a temperature of 102. How many days has he had the fever for? He's had it for the past, on and off for the past 7 days. Was he coughing? Yes. How often was the patient coughing? According to the patient, he's been coughing for the past 13 days. And how bad is the cough? Often, very often, or non-stop. So let's say very often. And did he have a shortness of breath? Yes. And then you would save it. As soon as you save it, you would get a message that pops up here telling the doctor what to do, to contact a number or to refer the patient to where he should go based on if there's a testing site, their information would pop up for him. So anyways, this is how a doctor would log and map out a coronavirus hotspot in Ethiopia. Then let's say another patient comes in and says, "Doc, I'm having problems, I'm having symptomatic." And the doctor asks all the questions, and he asks him, "Where does he live?" And the patient says, "I live over here." He has a fever, He has a temperature. He's had a temperature for the past 14 days. or 9 days. Is he coughing? Yes. How often is he coughing? He's coughing for the past 12 days. Shortness of breath? Yes. How often? Very often. And then you would save it. And then a message would pop up telling the doctor what to do or refer him with more instructions. Now, let's say another person comes into the doctor's office and the doctor checks him out and he asks where he lives. And the person says, I live over here. Then the doctor would fill out the same thing here. Fever, days, cough, yes. 4 days ago, I have shortness of breath. Yes, no, maybe 4 days you won't have it. And then you report it. And then let's say another person comes and he says, I'm feeling sick. And this person also lives around here. The doctor would also fill out the same thing. Fever, temperature, how many days have you had a fever? Are you coughing? How often are you coughing? How many days have you been coughing? Shortness of breath, yes. And then you save it. Now, as you can see here, a cluster is forming. So whoever at the government high level can see all these things popping up. And if you can see clusters like this forming here, 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 over there, and in different parts of the country. I mean, if we had doctors all over Ethiopia reporting where they're seeing the hotspots, like for example, somebody is reporting a case over here, then the government can see where the clusters are forming. And this is the early warning sign of people telling you that they're sick going to the doctors. Now imagine if you just even take it down to the public, to the citizen. If everybody had PhantomALERT and the government instructed them, use your phone if you're symptomatic to report where you are and your symptoms. This thing would light up with all the people that are having issues, symptoms, fever, coughing, shortness of breath. And then if you see a big cluster of 2, 3, 4, 500 people doing the same complaints from a particular area, that is where you would send your containment team, because that's where the outbreak is the worst, which means it's been there for the longest. And these are the people that are probably doing the social, they need to be quarantined and start practicing social distancing and also get tested and quarantine that area. So in short, this is how PhantomALERT can help the world and Ethiopian government or anybody use this platform. And this thing works anywhere in the world. You could report and you can see hotspots popping up like on a map. All right, let me also show you on the back end. So this is, you can see here, if this is admin, for example, if this was given to the CDC Ethiopia or CDC Africa, then you could see the alerts coming in. Ethiopia, 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 Romania, Romania, Romania. So these are our developers doing some test reporting. And by the way, this is not live data. It doesn't go live until it's approved by a moderator. So we can go in here, we can expire it, we can make it go live or not. So see this one it says no because I'm admin. So when admin puts it in, it goes live. But if it's not an admin, if it's a user or a doctor reporting it, then we would see it on the back end and we could manipulate the data. So we can see here that we have the date, the lat and long, latitude and longitude, a virus alert, and all this stuff. All this stuff will be showing. You know, we're also working on this, so we'll show you what the symptoms are, fever, temperature. All this stuff is getting added to the back end, and you have a dashboard here where you can see. You can go in here and you can have like restrictions. For example, here, let me show you. For a virus alert, anybody can report symptoms, but if it says required moderation. So check this if you want this POI to be verified by a moderator before appearing on the PhantomALERT map. So right now the default is anybody can report, okay, but unless they are a moderator, then you're not allowed, your data is not gonna go live. We're not gonna allow that to happen. But if this was removed, then anybody and everybody in the world could report and it would go live. But we don't want to do that because we don't want false alerts and we don't want to panic the public. So let them report, we'll verify, and then when it's official data, then we will release the. So you can see, you can geocode, you can edit. So now you can edit here, you can change the stuff here, you know, whatever comes up. You can add even comments and so on. And also one thing I want to show you is like if you're looking at this stuff and you want to know like, okay, so we have the Latin long, so where is this? So you can click here and it will take you directly to the map where the stuff was. So the back end is kind of cool because it has a dashboard that you can use. You know, we can see the latest point of interest that are coming. We can see after the people get tested, if the test came positive, or you can say thumbs up, thumbs down, positive, negative. All this can be customized to give you a lot of data points, and then of course you can export it, the whole entire database, you know, and then put it on a CSV file and give it to another agency or give it to the Prime Minister's office. Here you can look at the people that are registering. So I don't want to show any personal emails, but you can see here that these are the accounts that have been created. We can also show the activation list. So we don't want to show the email addresses, but you can see by creation date, you can see how many people have created, you can see how many people have downloaded the accounts, the subscriptions. You know, all this is going to be made free, but this is how the back end would work. Okay, so this is how PhantomALERT works. So in summary, we have the alert map. Okay, anybody can go to PhantomALERT.com, join for free, create an account, and then use the interactive map to report whatever they want to see. You know, go to the zoom in, and you can see where all the hotspots are creating. So imagine if all the doctors, nurses, and government officials who have a smartphone and who have internet connection, and if you give them a little education on how to do this, how to use this, it's very intuitive. If you watch this video, you'll probably know how to report from here on. And this is how the healthcare providers, even the public, can participate in finding out where all the sick people are and getting help to them as soon as possible. That way we can stop the spread. Okay, thank you.